Hello, this is the podcast for SF PDA SD, the San Francisco PDA student chapter. This podcast was recorded on July 17th, 2020. This podcast is with me, Nick Cap, the student club advisor for the West Coast student chapter PDA. Maria D'Aguilar is our student chapter president and editor, and she will hopefully be joining us at the end of the summer. This is a series of weekly podcasts that are going to be from 5 to 10 minutes long, as requested by our editor. I was hoping to make them a little bit longer, but that's the case. And what we intend to do is to inform and educate a new generation of pharma manufacturers through discussions of links, stories, and kind of interviews. If it can help if we could do that. Please help us help you. In the coming weeks, we'll be trying out various ways to inform our listeners to what it takes to work in the pharma manufacturing sphere. And if you're interested in these wonderful jobs, then please help this. We are for the very beginning students. And so we're helping you kind of understand what this industry is and what some of the concepts are in the industry. And so we will talk about many different ways to support your biopharma manufacturing listener, and we're committed to our chapter of the Peritoneal Drug Association, which connects people, science, and regulation. It's very important. So you, the people, we're connecting you with science and regulation. This is the Mask Podcast. I will take this development off, but are we seeing the development of a new regulation here? And so part of the PDA is looking at regulations. So I think this is a very exciting time for us, which we can see new regulations that are popping up as to opposed to the mask wearing. And again, remember the tagline for the Peritoneal Drug Association is connecting people, science, and regulation. You know, we're still learning. A growing body of evidence supports the idea that wearing face masks in public, even when you feel well, can help curb the spread of coronavirus. Since people can spread the virus even without showing symptoms, that's the main reason to wear a mask in public, to protect other people from you. The World Health Organizations, the Centers for Disease Control, and even NPR, all National Public Radio, all published on ways and whys we should wear masks recently. What's really kind of interesting, I'm a little bit older for this, but a lot of you, Bill Nye, the science guy, even talked about why you should consider wearing face masks. So he published a public service announcement on wearing face masks, and you can take a look at that, and I have the link here. More and more places are making requirements for wearing a mask in public. And again, is this going to become a regulatory thing? It seems like as of the 10th of this month, about 21 states have a requirement for wearing masks in public. And so government regulation refers to the implementation of rules by government agencies that is backed up by law. So that probably means you can either get a fine or a prison term if you don't follow that regulation. The employment of legal instruments for the implementation of social or economic policy objectives. And so basically what we're looking at in a regulation is something that's either good for our economy or good for our society. Regulations are intended to keep us safe and to level the playing field with manufacturers. And so again, if somebody doesn't wear a mask and they have an unfair advantage over people who wear the mask, then people aren't going to wear the masks. And so what you may see is more and more people wear masks because, again, it's a requirement. It's not only a good idea, it's a requirement. Again, this is like the Pure Food and Drug Act, which is going to be one of our next podcasts looking at. We're going to look at that. But basically in 1906, people came together and said, you know what, we need to regulate this stuff. We need to regulate foods. We need to regulate drugs. All masks are not created equal. The cloth mask is actually an air diverter. Anything that covers the face that has a tight weave is basically preventing our breath from going straight out of there, and it's kind of diffusing it. It's also collecting aerosols and things like that so that they don't come out. These cloth masks aren't regulated by the FDA or any other governmental body. Some of them are better than others. Some people wear ski masks, which you can basically spit through, and some wear actually cloth masks that have several layers in them that are quite good. The surgical masks that you've seen, again, some of these pass requirements, but the FDA, but most do not. In general, surgical masks are regulated under the CFR, the Code of Federal Regulations, 878.4040. They are basically meant to block large particle droplets, splashes, sprays, or splatter that may contain germs. And so again, you would wear them typically before we would wear them in surgery, and you prevent things from getting on you, and you prevent things from getting out there. We can use these. Again, some of them are regulated. The N95s are more of a respiratory protective device. NIOSH can actually, if you look at your N95s, they need to have a NIOSH logo on those in order to be protective. There are some materials that are coming out that are kind of fakes that are coming out. Again, they need to achieve a very close facial fit and have a very efficient filtration of airborne particles. Okay. From a National Geographic article, regardless of whether you choose a cloth or surgical mask, be aware that does not mean you can suddenly be in prolonged close contact with others. These masks might buy you a few extra minutes of protection, but not hours, and not for lengthy periods of time. Now, there is some pushback on people not wearing masks, and this is some information that I got from MarketWatch.com. Basically, the president's reluctant to wear masks in public, and so why should I wear a mask if that? We rarely wear a mask in public, do not want to admit that this is kind of the new normal. Again, you want things to be how they were, and this is not normal. Men are less likely to wear a mask. It's a sign of weakness, or sign that you don't care, I guess. Higher earnings. People with higher earnings are more likely to wear a mask. 80% of New York and Los Angeles wears a mask, 60% outside of those areas. So different people don't wear masks for a different reason. But again, like any regulation, there's a number of people who don't want to do it, whether it's not convenient, whether it's not what you've done before. That's not what you can do. This is the Surgeon General here, and our Surgeon General actually, I think on the 10th, gave a nice little talk talking about the change of the mask policy. And so for a long time, again, we have not kind of recommended doing the mask. But again, we're learning. This is probably a bad thing in that before this, we used to laugh at people who wore masks. Again, when this event was first happening, I would see people with a mask and I would kind of laugh at them. And again, when we did this, we thought that social distancing would be better, that if you're far enough away from somebody, aerosolized or airborne or aerosolized. Airborne basically means the germs are in the air and they're kind of floating around. They can go a lot. And aerosolized, they're part of an aerosol. They're part of a larger particle. If you breathe it out after a couple of meters, it kind of just falls to the ground. And so the idea was that when you were 6, 7, 8, 10 feet away from people, that you're not going to be exposed to this, but you don't need a mask. And again, we're learning about it a little bit more. What we also seen is that before with diseases like this, but you had to have symptoms in order to spread disease. Well, what we're finding out now is that people who don't have the symptoms can be spreading the disease before they develop the symptoms. And so that's something that we really want to look at and do that. When you wear a mask, it's protecting me and it's protecting you. Both of us together are protecting one another when we wear masks. Again, the president is tested every day, so he doesn't have to wear a mask. But even then, people are convincing him, and he has started to wear a mask in Publix. Again, these are recommendations that have been changing. And again, what we probably should say is kind of we're sorry. When we used to laugh at people who wore masks and stuff like that, that was not the thing to do. And again, it's biting us back a little bit. Surgical masks and N95s are reserved for healthcare providers. And so what we're seeing is kind of what is a mask. And so those N95s that you're looking at, those are respirators. The surgical masks are different. These cloth masks that you have, it's like wearing a pair of underwear. It's like wearing a pair of pants. again, that may be the new normal when we go out, is kind of wearing these materials, protecting each other from that. And so, again, it's kind of one of those things of that where the science hadn't been developed yet, and now we're having to develop a regulation because people kind of won't do it on their own. The World Health, so I will post these as well, but the World Health Organization is advising us on using masks. National Geographic had a great article on how to make a mask that everyone will wear. And so, again, if it's fashionable, you'll probably wear it, and it works as well. Mask wearing is getting kind of more normal. As the numbers rise, wearing a mask is going to be kind of part of our normal day, everyday life, although that's a little bit bad. That's it for today's talk. Again, in PDA and our student chapter of the PDA, we're connecting people, science, and regulation. Again, make a connection, encourage someone to wear a mask. The science is evolving. Again, we did not discover masks. Masks aren't new, but again, our concept of why we should wear a mask. Again, and when we originally did this science, the coronaviruses before didn't transfer unless you showed symptoms and stuff like that. And again, this hasn't really changed. In the past, people would recommend people wearing a mask when they had symptoms, but now it's like we don't have symptoms. Also, the idea of a mask. A cloth mask is different than a surgical mask, which is different than an N95. The N95s and the surgical masks are in relatively short supply. We need to save those for our first responders. The cloth mask that we have would go a long way towards helping us. Again, if we're not in our houses practicing social distances, the masks are that, but they're not perfect. Again, this is a new regulation. Are we going to follow it? Who knows?